Lymphatic drainage of pharynx, opening of oropharyngeal isthmus. Here you can see mucosa associated lymphoid tissue MALT. Inner Waldeyer ring is the collection of lymphoid tissue guarding oral and respiratory openings. Inner Waldeyer's ring comprises of lingual tonsil on tongue, palatine tonsil on palate, tubal tonsil in nasopharynx near the opening of eustachian tube, adenoid or pharyngeal tonsil at the roof of nasopharynx. The lymph of inner Waldeyer ring drains into outer ring of cervical lymph nodes. Lymph nodes of inner Waldeyer ring drain into pharyngeal tonsils, retropharyngeal lymph nodes, tubal tonsil, jugulodigastric lymph nodes, palatine tonsil, jugulodigastric lymph nodes, other upper deep cervical lymph nodes, submandibular lymph nodes, lingual tonsil, submandibular lymph nodes, submental lymph nodes. Lymph nodes of inner Waldeyer ring drains into outer ring of cervical lymph nodes. Pharyngeal tonsil, retropharyngeal lymph nodes, tubal tonsil, jugulodigastric lymph nodes, palatine tonsil, jugulodigastric lymph nodes, other upper deep cervical lymph nodes, submandibular lymph nodes, lingual tonsil, submandibular lymph nodes, submental lymph nodes. Submandibular and submental lymph nodes eventually drain into lower deep cervical lymph nodes, jugulo-omohyoid lymph nodes. Scalp, layers of scalp, outer to inner, mnemonic also scalp, skin, connective tissue, aponeurotic layer, loose areolar connective tissue, pericranium. Skin, connective tissue, aponeurotic layer, loose areolar connective tissue, pericranium. Occipitofrontalis muscle is the muscle of second pharyngeal arch and is supplied by facial nerve. Occipitofrontalis muscle is the muscle of second pharyngeal arch and is supplied by facial nerve. True surgical scap, skin plus dense connective tissue plus aponeurotic layer. True surgical scap, skin plus dense connective tissue plus aponeurotic layer. The true scalp can easily move over loose areolar connective tissue. Therefore, this is surgical plane. Loose areolar connective tissue. It is the surgical plane of scalp. It is present below the true scalp. True scalp can be moved over this layer. Tissue expander can be put in this layer because this layer is the surgical plane of scalp. It is an avascular layer. Loose areolar connective tissue is also known as dangerous area of scalp. This is because any arterial blood here can be stopped quickly. Any collection of pus or infection in this area can be easily transferred intracranially into dural venous sinuses through emissary veins. This can be fatal. Triangles of neck. Anterior and posterior triangles are divided by sternocleidomastoid. Sternocleidomastoid muscle. Origin. Sternum and clavicle. Insertion. Mastoid process behind the ear. Action. When contracted, it moves the muscle to opposite side. It is the boundary line between anterior and posterior triangles of neck. Posterior triangle. It has two subparts. Boundaries of posterior triangle. Anteriorly sternocleidomastoid, posteriorly trapezius muscle. Base. Middle 1/3 of clavicle. Posterior triangle is divided into two parts by inferior belly of omohyoid. Subparts of posterior triangle of neck. Subclavian supraclavicular triangle. Occipital triangle. Contents of occipital triangle. Spinal axis nerve. Run superficially and supplies sternocleidomastoid and trapezius muscle. Branches of cervical plexus emerges from behind the midpoint of posterior border of sternocleidomastoid. Interscalene triangle containing the third part of subclavian artery and brachial plexus. Important information. Trapezius muscle. Origin from occipital bone skull. Insertion. Scapula bone posteriorly and clavicle anteriorly. Action. Helps in elevating the shoulder and helps in shrugging of shoulder. Omohyoid muscle. Origin scapula. Insertion lower border of hyoid bone. While draining an abscess in posterior triangle, an iatrogenic injury of spinal axis nerve may occur. This causes paralysis of trapezius muscle and causes difficulty in shrugging shoulders. Cervical plexus, third part of subclavian artery, and brachial plexus can be blocked through occipital part of posterior triangle. Trapezius muscle, origin, insertion, action. Omohyoid muscle, origin, insertion. cervical plexus, third part of subclavian artery, brachial plexus. Blocked